We're going to play what we call the chest pain game. Chest pain game. So please, this one, get your keyboards ready. Be ready to type. Be ready to type. And what I need you to do is to give me the most likely diagnosis and the most accurate test. That's all. No long talk. Most likely diagnosis, most accurate test. Doctors, are you ready? Let's go. Number one, you have a patient with chest pain plus chest wall tenderness. Please type your answer. Chest pain plus chest wall tenderness. Chest pain plus chest wall tenderness. Beautiful, beautiful, beautiful. I'm seeing some good answers. Costochondritis. What's the most accurate test? It's just on physical exam. You don't need to do any chest x-ray or anything. Chest pain, tenderness on palpation, costochondritis. Most accurate test, physical exam. Doctors, can I move on? I'm moving on to something else. Next game. Chest pain radiates to the back. The blood pressure in the right arm is, sorry. Somebody was writing on the screen. Chest pain, it radiates to the back. Blood pressure in the right arm is 190 over 110. Blood pressure in the left arm is 110 over 80. What is your diagnosis? Just type the diagnosis. Beautiful, beautiful, Dr. Abiola, beautiful, beautiful. Aortic dissection. What's the most accurate test? If you do a chest x-ray to show you a wide mediastinum, you do a CT of the chest and MRI, and then you can confirm with transesophageal echocardiogram. Aortic dissection. Blood pressure is different in both arms. Let's go to the next case. 35-year-old male, chest pain, worse with lying flat, feels better when he sits up. What's your diagnosis, please? I'm happy. People are getting it. People are getting the concept. Acute pericarditis. What test will you do? You do an ECG. What will it show? Electrocardiogram. ECG will show ST segment elevation everywhere. And then you'll also see PR depression. Hello, doctors. I'm getting excited. Okay, next case. 35-year-old male with chest pain plus epigastric discomfort. Pain better when he eats. What is the diagnosis and what's the best investigation? Answer: peptic ulcer disease, duodenal ulcer, GERD. Most accurate test: endoscopy. 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 Okay, next one. 38-year-old male experiencing bad taste in the mouth with associated chest pain and cough when he lies down to sleep. What's your diagnosis? What's your diagnosis, doctors? Doctors of the noble profession. What's your diagnosis, please? Beautiful. People are getting it. Gastroesophageal reflux disease. Most accurate test, if they respond to proton pump inhibitors or aluminum hydroxide or magnesium hydroxide, them responding to it itself is diagnostic. And that can also be therapeutic as well. Okay? Good. Next one. 38-year-old male experiencing chest pain with a 3-day history of cough, sputum production, and hemoptysis. Temperature is 38.7 degrees Celsius with a respiratory rate of 25 cycles per minute. What's your diagnosis? Dr. Med, I'm so happy for you. Dr. Froza, oh my goodness. Dr. Juliet, now people are getting it. So you see, that's what I'm saying, that this exam is not just about sitting down to read a book. It's about recognizing patterns. And what's the best investigation? Chest x-ray. Diagnosis is pneumonia. Best investigation is chest x-ray. Okay, good. Okay, 56-year-old male had right femoral fracture surgery 4 days ago. Sudden onset shortness of breath, tachycardia. Oxygen saturation is 65% on room air. What's your diagnosis? What's the investigation? PE. And what investigation? Spiral CT or VQ scan. D-dimer is non-specific. D-dimer is non-specific. All right? PE. Doctors, today I'm very happy.
Dr. Boni, Dr. Boni, I have a question, please.
Please ask.
Yeah, regarding that question with the femoral fracture, how do you differentiate a fat embolism from a pulmonary embolism?
Most of the time, fat embolism occurs quickly, right after. Yeah. And then at times, they may also have petechiae on the body.
Because it's very common
It's
with
very
the
similar.
femoral fracture. Yeah, it's very similar. And most times they tell you there was a femoral fracture.
And frankly, if you had told me it's a fat embolism, I wouldn't hold you for it.
Okay,
That's also that's also a differential. Yeah. Especially when so maybe I should have gone for like
Can
hip
you go
fracture.
back to the question, please?
Maybe I should have gone for maybe something like a hip fracture, you know?
Yeah. Just
Because as soon as I go with femoral shaft fracture, that changes fat embolism also becomes a very, very likely diagnosis. Okay.
Yes. Okay.
Good.
Thank you.
35-year-old male involved in motor vehicle accident with sharp pleuritic chest pain, tachypnea, and tracheal deviation to the left side. No air entry on the right side of the chest. What's your diagnosis? What's your next best step? What's your definitive management? Let's go, doctors. This is simple. Let's go. Let's go. Let's go. Tension pneumothorax. Beautiful. Tension pneumothorax. What's the next best step? Next best step. Next best step. No. I'm not going to take chest x-ray. I'm not going to take chest x-ray. In a patient with tension pneumothorax, I'm not going to take chest x-ray. I'm going to take needle decompression. Beautiful. What's the definitive management? Chest tube. Chest tube. That's a tension pneumothorax, needle thoracostomy, and then chest tube is the definitive management. So now, I may be wrapping up. No, we have some stuff as well. But how was the game, by the way? I have a question. How was the game? How was the chest pain game? The chest pain game. How was it? How was it? Doctors,
good,
please.
Good. Was great.
Good. Because then we are covering all the necessary stuff we need to know. Okay, good. So now, two things I don't want you to miss. If you have a patient with chest pain, with fever, chest pain plus fever, don't only think that chest pain plus fever is just pneumonia. Patients with pulmonary embolism can also have chest pain with fever, okay? So two diagnoses I don't want you to miss. Chest pain plus fever, pulmonary embolism, pneumonia. Okay,